Hi, my name is Mark Lim. I'm the co-founder of Lollaland, and we want to thank you so much for joining us. Today, we're doing an interview because we've met so many people with serious skin issues, eczema, dermatitis, and sensitive skin, and they're frustrated and they don't have any answers. So we're hoping that through this interview, we'll give some answers through my wife's journey, as well as the advice of a medical professional. Today we have Hanna, my beautiful wife and business partner, and also co-founder of Lollaland. And we're honored to have Dr. Marvin Rapaport with us today, who specializes in dermatology. We're going to start with Hanna. Tell us a little bit about your struggle with skin. Where did it begin, and how did you end up meeting Dr. Rapaport?
So I have had sensitive skin, quote, eczema since for as long as I can remember. My mother told me she couldn't even use, disposable diapers on me because I would break out in rashes. So I think as early as I can remember, I was probably using some sort of creams to treat this sensitive skin. So I think I remember in elementary school is when I really started using cortisone, just over-the-counter cortisone cream, like Cordaid that you buy at CVS. And I would use it every time I got a rash, but it wasn't like an everyday thing. It was very localized to like my inner elbows. And then, that was that. Well, in college, I remember, I think my senior year, I don't know if it was stress or environmental or whatnot, but I just broke out in these crazy rashes on my face, and they told me that I might have lupus. Like it was just blistery, weepy, and I was prescribed a very strong steroid at that time that I used to treat it. Eventually it went away. It took a long time, I think over a month, but that was just the pattern. I kept getting, I think, bigger sort of eczema flares in spots that I don't even recall having it as a child. I was a cheerleader in high school, and I remember wearing short skirts and being fine. Like, I don't remember ever having such serious issues in high school, and it started later in life to get worse. So then, after I was working and got married, it just progressively got worse, where I would switch dermatologists. The next one would give me some sort of steroid injection, and then I was prescribed prednisone pills for 2 weeks at a time, 3 times a year. And then I was given clobetasol, some sort of steroid shampoo and foam so that I could apply it all over my body more easily. And that was just sort of the path I was going down. It wasn't until a dermatologist suggested that I go on cyclosporin, which I wasn't familiar with at the time, but he said it was some sort of cancer drug, that I kind of said, wait, what's going on? Like it's just my skin. Like, how could I be going on a cancer drug for this? And that's when, I think you or my husband really started looking around the internet, like what to do about this red, burning, itching eczema. And Mark found a link to Dr. Rapaport. And lucky enough, I was in the Los Angeles area, so I made an appointment, and that's how we met. Yes,
I remember it became a shared experience because, your skin was your personal issue that I really didn't know much about. But when I found Dr. Rapaport and then turned it to you to say, hey, can you look into him? And you obviously did a lot more research than I did because you know more about it. You found that Dr. Rapaport did a study. So turning to you now, Dr. Rapp, you did a study on the Redskin Syndrome. Can you go into detail about that?
It really goes back 35 years, I hate to admit. I ran a special clinic at UCLA called the Contact and Photo Contact Dermatitis Clinic. And we would see patients who were referred in with unusual eczemas, rashes, unrelenting despite good therapy. The good therapy always being steroids. We evaluated them. It was studies of skin biopsies, blood tests, allergy testing, et cetera, and all was naught, all was zero. The history gave the answer. They all were eczema people in youth. They all had begun using steroids ad nauseum on a daily, weekly, monthly basis. And the story was always the same. Got better, then flared. Got better, then got worse. And in keeping with the word addiction, they would go to the next doctor who would up the ante to a stronger preparation, a stronger oral medicine, etc., etc. And then the patterns of rash were very peculiar. They didn't fit any known disease. So my answer was that they were eczema people who became addicted to steroids. And from there, we saw many, many patients, and I have to say they all were cured over the course of time. We'll get into that in more detail, by just stopping the steroids and supporting them through the ordeal that Hanna mentioned. It was and is an ordeal for everyone.
So can you go a little bit more detail for those that maybe have taken topical steroids, but they don't exactly know what that is? Like, what are some examples of some topical steroids?
Well, there are a couple points. First off, when you study disease, you study the natural history of every disease. That's why we go to school. So you know that cancer of this takes this period of time before problems. You know that colitis takes this. You know that colds take 5 days. Eczema burns itself out. If you study disease, it burns itself out by early teen years or maybe 4 or 5. It stops, just like Hanna said. Hers stopped. And if it comes back a little bit in the future because of dryness, because of winds, because of some irritant, because of being incited by poison oak, you use the steroids minimally for a short period of time. Once it gets ongoing, then it's addiction and it's the steroid. It's not bad eczema. That's number one. Two, we know the nature of steroids. Steroids closes blood vessels down and stops inflammation. Well, when they are red, rub the stuff on, they suddenly become pale, the vessels close down. Wow, this is a great medicine. But 2 to 5 days later, they get red again. They put more on. It's that neon sign business, that rebound, jack-in-the-box business. And they keep doing it. And if they get in the hands of the wrong MD, oh, you got bad eczema. Oh, you should get rid of your dog. Maybe you should reevaluate your husband. Get rid of the kids. You're allergic to them.
Right.
I've heard it all.
Right.
I'm making fun, but I don't mean it I mean it to make my point. That it's the drug, it's the therapy, and they're not being aware. They're not listening to the patient. Listen to the patient. They'll tell you they get worse when they put the stuff on. Sounds pretty. The elevator operator could make that diagnosis.
Right.
If there were any more elevator operators.
Right. So your recommendation, as you said earlier, was withdrawal. Tell us a little bit more about the process, like going cold turkey versus tapering down your usage. Because obviously their body got to a point where, look, it's time to get this out of your system. So.
And I'm sorry, I'll backtrack 1 second. Just like Hanna had said in her youth, she used it for a little bit, goodbye, rash over. So I'm not saying I'm anti-steroid. You use it for an appropriate short period of time, and if you start rebounding or flaring, that's the wrong therapy. You must take a different approach. We use steroids. It's a wonder drug. I'm sorry, I went off.
That's okay.
Question. Say
Yeah,
that again.
The question was more based around the actual withdrawal.
Oh, okay. Yeah.
Because you might, I'm sure, as we know, it was a dramatic process. And so someone might suggest, what about tapering off? And what are your thoughts?
The whole tapering off process has been ongoing in medicine for 60, 70 years because of steroids, but oral steroids. The theory was when they were given for arthritis or for colitis or for something else for months, but we want to take you off of it. The theory was that the adrenal gland shuts down because the steroid stops the adrenal gland from secreting its own cortisone. So it goes back to the pituitary gland and it shuts off the system. So if we taper you down, your system will rejuvenate and reinvent itself and do what it's supposed to do. The theory was tried in the topical, but the mechanism here is totally different because it's a blood vessel problem here. It's closing the blood vessels down. It's got nothing to do with shutting off the adrenal gland or anything else. So it's a fallacy. And every time you cut down, and people do, and doctors do, they would flare. You get to a low dose, and they flare again. And we went too fast. We went too slow. It's always, that we should have done. No. You got a cold turkey.
Okay, that makes sense.
I think I also just wanted to mention, when Mark actually introduced me to your just premise, and it's kind of a weird feeling because you feel like you're literally being called a drug addict, and it's something as simple as creams, which I think it was really hard for me to explain to my friends and family. Like, I'm doing this withdrawal, and it sounds a little crazy, especially because it's just not using a cream.
But similar, the word addiction, as you need more and more cream, you need to up the ante with a shot, you need to up the ante with oral prednisone. That's what all the meth addicts go through, the heroin addicts, the cocaine addicts. They need more and more and more to satisfy that tremendous craving.
Yes.
And in this situation, the skin is saying, I want you, I'm going to burn until you give me what I want. You rub the stuff on, burning goes away, wonder drug.
Right.
But it's just like all the other addicts.
Okay, so Hanna, going back to now, you met with Dr. Rapaport, you read his study, you heard his recommendation. Tell us about your withdrawal journey, and how did you decide, okay, this is what I'm going to do, and then what happened to you from then till now?
Okay. So I was at a point where I was actually pregnant with my third child, and it wasn't just the normal spots that I was getting rashes. This time it was like almost 75% of my face, my entire back, where I couldn't even lean back against a chair. It hurt too much. It felt like it was just burning and raw. And, Mark found information on your study. So I came to see you, and I read other people's blogs who had done this withdrawal. And it was a nerve-wracking thing to decide to plunge into it, but I had no idea what I was signing up for. I thought, okay, I'm going to come see you monthly, check in. It's going to be bad. My skin's going to look awful, and I'm, going to have to swallow my pride and deal with it. But it was 100 times worse than that. Physically, I think I remember the day I stopped using my steroid creams, I started swelling up like a balloon. Like, my eyes were almost swollen shut. And then I became just very red and oozy. Like, fluid was just dripping out of every pore in my body. And it was also painful. Like, I just felt like I had raw skin, and it was prickly. So imagine having, a raw open wound and that being 100% of your body. It was the most painful, unbearable thing ever. On top of that, not that I don't consider myself a vain person per se, but it was really hard to just even look a cashier at the grocery store in the eye. Like, I just felt so self-conscious. I was constantly wearing hats, but that didn't cover anything. I would wear a long sleeve shirt, but my ooze was dripping through it. It was horrifying. It got to a point where I couldn't even wear clothes because it would stick, and then I'd have to peel it off and it'd be raw again. So Dr. Rapaport told me to sort of stay in the bath during those times. And I was just immobilized. Like, I couldn't carry my own newborn child. I couldn't care for my toddlers. I couldn't do anything. I couldn't work. And I had to call in my family to sort of help me and nurse me back to health, which they didn't even believe that we were doing the right thing. They just couldn't believe what was going on. And they could not understand and almost couldn't believe that it was just from stopping steroid creams.
Obviously, when you're going through this withdrawal, you're going to have to answer to a lot of people. Your life changed dramatically. We moved out of our house. You couldn't hold the baby. You were oftentimes away from the family to recover from this withdrawal. And that probably stirred up a lot of reaction from friends, from family, and everyone coming out of the woodwork saying, oh, who's this Dr. Rapaport? We have a dermatologist. How did you manage all that? And what was your answer, especially because this is kind of a new path for you.
Well, I think most people that decide to go on this journey, they've tried it all. They've tried the Oriental medicine. They've tried, the dermatologist next door. They've tried even the specialists. Like, I've seen people saying, I flew to Johns Hopkins University because that's where the best dermatologist is. And so I was one of those people. I felt like I had exhausted every resource to deal with my skin. And this was the only thing that, when I really thought about it, it made sense. And so when people would approach me with, okay, here's a cream my grandma brought from Korea, this is like a miracle cream, or, I didn't want to sound crazy, but I was like, well, chances are there's steroids in there, and I'm trying to avoid that. So I think the biggest thing was just convincing my friends and family that I had to do this for myself, and I know this is right.
I must say, to support the opposing opinions, that there are a lot of nuts out there in medicine who are selling things, who are telling you to buy this, eat this food, buy my supplement. So this might fit into that category in the ears and eyes of many people, when it's the exact opposite. I'm not saying, just stop it, don't do it anymore.
And before I ask Dr. Rapaport the next question, talk to us a little bit about the timeline. So you went to withdrawal. How long did it take? And how long did it take to get for you to feel comfortable in your skin and to where you are looking now, stunning, of course. Talk to us about the months and how long you've been using and how long it took you to get to this point.
Okay. So I've been using steroids, I want to say I'm 35 now. So I can't definitively say because I don't know what my mother has put on me as a child, and she frankly can't even remember. So I'd like to think that it was almost my entire life, just because she said that I had terrible diaper rashes. Like, rashes were my reality my entire life. So I probably have been using steroids my entire life. I think I started using very highly potent steroids in 2005 or 6. So that's like, what, 9 years? And I started my withdrawal, and I think the first 4 months were absolute hell. I mean, that's when we had to move out of our house. I was living in a bathtub. I just could not function, and there was no light at the end of the tunnel. I think after 4 months, I think for me, I felt like I was in a constant flare. People talk about flares, but I just feel like I was constantly bad for that 4 months. And then I got a little bit of a break where I even wore short sleeves. My skin wasn't perfect, but it was so much better. And then I sort of, I guess, relapsed, and I had another. So I had maybe 3 months of decent skin where I could function, live life again, go outdoors. And then it got really bad again. And it was probably really bad again for about 4 months again.
Okay.
And that's when I didn't see anyone. I was just holed up in my house trying to deal with the pain and looking like a monster. And after that really second bad flare, it was a very slow uphill climb to where I am now. It's just...
So total time...
I think right now it's been about a little over 2 years, so maybe 2 years and 4 months.
Okay.
To where I am today.
2 years and 4 months of this. Now, quickly go over, when you say pain, what do you mean pain? Like, what was there a peak moment during the day? Was it all day? Was it burning? Was it pinching? Was it prickly? What kind of pain were you in?
So let's start with the evenings. I felt like I didn't sleep a wink. I felt like I was literally just clawing at my skin, scratching. The itch is just indescribable. It almost feels like your skin is trying to come off and your body's wanting you to scratch it off. So I felt like for 10, 12 hours, supposedly during sleep hours, I was just scratching. Then I would wake up exhausted, but, bloody, oozy, itchy again, and like just in sheer pain. So I would jump in the bathtub. And then to describe the pain, it was just, I don't know, like a nerve tickling, just pain all over.
Like
it's
burning?
not, yes, and you feel like you're on fire. I mean, I even purchased ice packs in the shape of my face with the eyes cut out to sort of alleviate some of that burning. But I mean, you just feel like you're on fire, you don't have any skin protecting you from the outside world, so even, you know, like someone would sneeze on you and you feel like it hurts.
Okay.
So it was that type of pain.
Can you walk us through medically what's happening to Hannah's body during this withdrawal? What is causing the flare? What is causing the burn, the hair falling out, the skin just looking like it's on fire, and then, you know, coming with all the wrinkles and the flakes and all that? What's happening medically to her?
Basically, the steroids close blood vessels down in the skin, topical steroids. Then, as they get to the end of their addictive phase, when they finally get to see me, they won't close down anymore. They just stay red. So the skin is red all the time. And the symptoms that Hanna described are very evident: the itching, the burning, the anxiety, the pain, more than itching, or more than burning. So we have to close the blood vessels down. We don't have very much. When I tell you my best drugs at that phase are ice and cool baths, you say, huh? That's it. And I got drugs for the other. I've got drugs for sleep, for pain, for itch, for ooze, for edema, for burning. I have to use those medications. And as Hanna said, she dropped out of society. There have been teenagers, they have dropped out of school for 6 months to a year. There have been adults who dropped out of work, cannot function, because I don't have any magical formula. But I'll touch that in a second. And they go through these episodes, and it seems to be, in my research, we did a study of nitric oxide, which is a chemical in the blood that opens up the blood vessels. And the study we did was for a year, and the red patients still had elevated nitric oxide up until the year when we ended the study. So there's a mechanism, there's a chemical involved. Why this long? Don't know. I don't have that answer. But it finally does stop. So the vessels open up, and they stay open, and the patients are red, but because there's fluid coming out from the bloodstream, they start oozing out, and they get wet, open sores, or they get swollen in their face, like Hanna described, like a melon. She's lying down and the fluid collects around the eyes, or on the legs. And that's edema caused by this outpouring of fluid. So all of these complaints are very logical, pathophysiologically, and are handleable, and I hope I'm not, being inappropriate. Yes, I see the patient every 3 days, every 7 days, every 14 days, and try to reassure, and you're doing well, and you're doing well. But the hell that they go through 24/7 is indescribable. And I hope that the 3-day visit and the 7-day visit helps, and the phone call, and the whatever is needed. They go through absolute hell.
Right. So I'm sure you get this question a lot. Is her length of withdrawal typical? Is there typical? Is there a correlation to how long they've been using it? Or, talk to us a little bit about someone that's listening to this and saying, I need to start withdrawal. How long do I need to spare for this?
The best I can say is, in my mind, in asking the history, so you've been using a weak strength cortisone, and then you went to a stronger strength cortisone. Oh, you got some prednisone. Oh, you got a shot of Kenalog. Oh, and you kept putting more of the super potent steroid on. It's going to take that long for you to get better. Oh, you put on a medium strength for only a couple months, about 3-4 months, and no cortisone, no pills. It's going to take that long for you to get better. Usually, that's a pretty good system to follow. Everybody wants to know how long. Nobody can remember exactly how much steroid they use. I'll have people come in and tell me how many tubes they use, how many years, and I sort of estimate in my mind. When I hear they've been using for a couple years, it can take 1 to 4 years. 1 to 4 years.
1 to 4 years.
So Hanna being at 2 years is probably the average. But she did use super potent stuff, she had pills, she had this, so she was at that level probably. And it's not easy. Nobody is better in a couple of weeks. Nobody. And I'm sorry, I'll backtrack. Maybe this is a little helpful to the people in the audience. At the beginning, I will assess what is going on in their life. Once in a while, well, my daughter's getting married in 3 weeks. We have a trip planned, the whole family on the ship in 2 weeks. I say, you know what? Stay on the steroids for those 2 or 3 weeks. We'll start the withdrawal afterwards, because I don't want to ruin this very major part of your fun life. So that's the only time I'll backtrack. But once they start the withdrawal, we unrelentingly hold their hand and get them through this. And I can only admit that it takes a very strong patient to continue, but so far I think my power of persuasion has worked. I don't think we've lost but a few who wouldn't stay off the steroids. And we've seen 3,000 patients.
Tell me a little bit about your patient's age. Sometimes it seems from what we've seen through groups, there are children that have reached that quote-unquote point, or there are middle-aged women or teenagers. Like, what's the reason for? Is it just that they can't handle it anymore, or is there a max that their body said, you know what, I'm done? Tell me a little bit about what's in your experience.
Initially, for at least the first 20, 25 years, Hanna's age group were the only patients I saw. They had eczema as a kid, cleared up, goodbye. In college or at 30, they got a little rash and they got addicted then, and it went on for 3, 5, 7, 20 years. As we published the papers, and as we got, a patient came in from Florida, flew in, was addicted, was very into this, and started a tax-free called Eczema. We started seeing younger people because it was on the tube. Recently, because of other things that we've done, or it's been out there because of interviews, started seeing 6-month-olders. Never saw that many young ones before. I'm seeing a deluge of little guys now. Those who are addicted, and I'm beginning to see, because the mothers are saying, I don't want to put my baby on steroids, I've read about bad things, I'm beginning to see mild eczema who are not addicted yet. And they're asking my advice, thinking they're addicted already, or they're afraid to go on. So it depends upon what's going on in the outside world. I have to tell you that probably 50% of the population has atopy. They're eczema, asthma, hay fever people. So the chance of eczema is immense. The chances of eczema presentation is immense. And the ubiquitous nature of over-the-counter steroids, which was fought 20 years ago or 25 years ago by doctors for fear of addictions, and the ubiquitousness of, we'll just write a prescription for you, you need something stronger, and I'm being sarcastic, but get her out of here, I want to do the Botox patient next door, not listening to the story, which angers me. We're seeing an amazing amount of people. I've seen itching older women, the backs itch in the winter, it's called winter itch. So they go to their internist, they go to dermatologists, they go to an allergist. They've been putting steroids on since September. It is now June of the next year, and they're on fire. They're addicted to the steroid just from the diagnosis of itch, which happens in the winter. I've seen insect bite people, a couple on the leg, steroids for 3 to 7 years. Addicted. We've written a paper about phenol peels for anti-aging, and in their wisdom, the plastic surgeon dermatologists give them steroids so they won't be that red, and they get addicted to the steroids. And he looks and he says, oh, they're still red, it must be because of the procedure. Give them a stronger steroid. Ta-da, ta-da, ta-da. So there have been many reasons, but the vast majority are eczema people. who have it on an inherited basis.
I think me too. I mean, just anecdotally, what happened to me, I started to see my children having eczema, which is really common. And with my first daughter, this was she's now 7. So 7 years ago, I would go to my pediatrician and say, she has a rash, like I need something, like, you just never want to see a baby with a rash. Like, babies are supposed to have perfect skin. So I think my being a mother and just wanting to treat something quickly, my thinking has totally changed after my own withdrawal. And with Zoe, my third child, she had just from milk rash, like, spitting up, lying in it for a little bit, like she would just get rashy, raw cheeks. And so I said, you know what, Mark, let me try something. I don't want to put anything on it. Aquaphor maybe, just to keep it hydrated. And it took a long time. I want to say 6 months. She had this rash, but sure enough, it just kept getting smaller and smaller. And now 3 years later, she has perfect skin. It's never come back. And I think if I have to say anything, I mean, obviously there are times where there's infection or you really do need to see a doctor, but just waiting some of these things out is the biggest piece of advice, because that's not what, I was a kid in high school and college and I wanted my skin to look perfect so I could wear that dress, and so you just want this immediate relief. But, just letting your body fight through the rash that you could get from anything, a new detergent, like.
Well, and you're quite accurate, and I'll go one step further. The desire of the parent or the in-law that child should be flawless demands that every rash get effaced instantly. So you get into that trap very quickly. So your stance on, it was a little bit of irritation, little milk, a little, it'll go away.
Totally.
And you live, every cold doesn't need to be treated, every, sprain doesn't, et cetera, et cetera, et cetera. We overtreat, and this can cause tremendous calamities. If you would have put steroids on her face, it would have taken a year. The face is murder for steroids.
Hanna, tell us about your lowest moment. Tell us about the hardest time, because I think that's going to interest a lot of people to say, okay, you're talking about a long journey. Mm-hmm. How hard was hard?
Okay. So when I started my withdrawal, I wrote my closest friends and family an email detailing what I was going to do. And I warned them, like, I may not see you, but it's, I'm still thinking of you, but I feel like I need to do this. And I thought I was being a little dramatic at the time, but I'm so glad I wrote that email, because people just understood, and they were so gracious with sending flowers and meals to help Mark and the kids. My lowest point, I think, came at about 10, 11 months into my withdrawal, because, I know you and everyone tells me it could be 1 to 4 years, but I was convinced that I was going to be that one that would be clear in a year and I'd be scot-free and great. But at my 1 year mark, when I was just still doing terribly, it was one of my lowest moments. I was like, I don't know what I'm doing. Maybe Dr. Rapaport's a quack. Maybe, I'm a very bright, cheery person overall, but I really think I had a deep depression, and I was actually suicidal. I think it just kept going through my mind, like, I can't live like this, I can't have my children look at me in this state, like, just sitting in a bathtub all day, looking like a monster. And it was that mentally and emotionally trying.
It's horrifico. I've seen probably 6, 8, 9 patients who were suicidal. Talk about it, we discussed it, obviously we got them through it. It's a terror. The low moments, okay, and then that brings up one subject that I was going to touch on. This warrior state. I can do it alone. I can tough it out. You need help. You don't need a psychiatrist. You need somebody. I think what happens is that they go here, there, and everywhere, and nobody seems to have an answer for them, so they get worse. But once they find somebody who understands and will hold their hand and get them the appropriate medicine, and not go, get her out of here, come in next week, I want to see you again. I found somebody who cares. That's what's needed, and it takes such a long time. But the end result is always worth it, and this will be forgotten about by Hanna. Believe me, she'll be like everybody else, and that's what I want. Just like you kick the kids out of the nest, you did your job, let them fly. You know, don't want to hold on to them. No, I don't want you to have rash anymore. Get out of here, you're perfectly fine.
Right. I mean, Dr. Rapp, I can't even tell you, you were such a rock to our family. I'd always say you were more than just a dermatologist to Hanna. It was almost like you were our family therapist. You know, it really, really helped to have you as a resource, and that, I mean, it's more than just the physical things that's happening to Hanna. I mean, truly, like you just said, the mental aspect is so underrated.
Well, and you're very kind, and I appreciate it, but that's how we were trained in medicine. You take care of the whole patient.
Right.
And that's critical to get them through. You must.
Right. Let's talk about diet. You know, people are going to say, should I change my diet? How much does diet affect, in your opinion?
Well, first off, all the little kids who get taken to the allergist to get testing, they're scratch tested, and that scratch is llama hair, elephant tusk, garbage, goose grease,
Right.
Oh, you're allergic, stay away from elephants. Stay away from zebras. We only have horses in LA, not zebras. They're sensitive, so they get positives. But they're not ever allergic to food. I have seen tons of patients who have walked in here not eating anything. When they're cured, they're eating everything. No inhibition about anything. It's a waste of time. And don't get started on every new fad with the gluten, with the no meat, with it's endless. Not only in this entity, but in everything. And believe me, unproven scientifically.
Right. Okay.
I think it's a factor also, that the patient wants control. Well, what do you have control over? What you put in your mouth.
Right. Right.
I'm in control now. Oh, I won't eat this. Let me look up this thing and that thing. Oh, I won't eat that. I won't eat that. It's got nothing to do with nothing.
Right. Okay. What's the big deal about baths? Why did Hanna live in a bath and eat meals in a bath?
Well, there are two 100% in this. 100% are cured and 100% love the bath. Period. It's like if you had a terrible sunburn. What do you do that night? You jump in the tub. The cool water, the tepid water makes the skin feel better. It's purely symptomatic and it makes them feel good. And you say to somebody, I'd like you to be in the bath for half hour. Let's make it an hour. And 2 weeks later they come back and they say, I was in the bathtub for 8 hours a day last week. And you say, I love it, because they were finally relieved. They couldn't do very much else, but at least they weren't in pain, burning, itch. They were relieved. The additives to the water are a waste of time and money also. It's the water, the tepid water.
Okay.
I think for me, just to echo that sentiment, I mean, literally when I was oozing in raw skin and my clothes were sticking, the bath is where I just found relief. Like, I wasn't sticking to things and just feeling uncomfortable, so.
And as an aside, there's been some pap on some of the media that bleach baths should be used because they're infected with staph. Again, that's called garbage. Garbage.
Okay. Good to know. You touched briefly on pain medication, and understandably, she's in a lot of pain, so she will need something to help kind of curb it, or also to help her sleep. What do you say about kind of trading one addiction for another? Because we know that Vicodin, Percocets, those type of medications you hear on the news. Oh, people were, highly addicted to it. What's the argument between trading one addiction for another?
Well, I've gotten this ritual of I think 6 or 7 symptoms. Give me a 1 to 10, please. Itching, burning, pain, ooze, edema. So the lowest, 10's the worst. And I see where the number is. And I'll say, okay, you're at a 7 level of itching. Let me really give you a lot of what I like, Atarax, that works well. Makes you a little drowsy. We might use capitalizone for sleep also. Are you sleeping? I'm really having a terrible time. I want to give you a sleeping pill. Versus the next person, I'm sleeping okay, I'm doing okay. No sleeping pill. So I tailor the medicines to the patient, whatever is needed. And I'm controlling, I'm watching, I'm on top of it. Nobody's going to get addicted with me in control. You need Vicodin because the Neurontin is not working for your burning. Okay, let me give you a 30-day supply, and I'm going to check on you. How you doing? Oh, I'm really burning. I'm really in pain. Let's talk about this. Maybe I got to do it a little differently. I won't let it happen. But when we talk about it, further addictions to medicines, I'm on top of every one of these. I've only prescribed, as best I know, those drugs that I can control that are not addictive. If there is one or two that might lead to something like Valium or Vicodin, I watch the patient like a hawk. I'll only give a certain amount. If they seem to need more and more, we have a long talk, and we got to reevaluate how to approach this. Some people are more neurotic, are more needy, are more so the docs unknowingly just write the prescription ad lib. No. You stop and talk to them and say, you can't do this. We got to reevaluate this, not just write the prescription.
Okay, makes sense. Now, I'm going to ask Hanna your last question, the whole purpose of this interview. Any last words that you would like to give to our audience to just kind of advice that you'd give? I mean, it's the whole purpose of this interview is to kind of shed that, the answers to some of their problems.
So I meet so many people with, quote, severe eczema, uncontrollable eczema. Even as a mom now, I have so many friends whose babies also, quote unquote, have out of control eczema. And so I just felt compelled because this was my reality my entire life. For the past 2 years, it was like all consuming going through this withdrawal. But if I could have a platform to share my own experience, that's why I'm here. I'm not a doctor, so I don't meet people on the street and say, you need to do this withdrawal. Like, I don't know what your history is, nor am I qualified to diagnose that. But what I do know is that I am so much healthier after doing this withdrawal. I don't worry about my skin day in and day out, because that was my reality growing up. Like all throughout my life, I was like, okay, my wedding's coming up next week. Is my skin gonna be okay? Probably not, so let me go on a round of prednisone. I mean, I would literally time my life events with prednisone doses, because I never knew what was gonna be happening with my skin. So I just wanna say to everyone out there, like, if this is you and if this story sounds familiar, to look into it. Like, go to Dr. Rapaport's new website. Just really reevaluate what you're doing and what you're using on your body and on your child.
Okay, any words of advice for someone that's going through the thick of withdrawal? What helped you survive?
So what helped me survive was just getting on the forums, talking to people, reading over and over people's blogs or vlogs of just success stories. I think just to know that there's like one other person even out there that's gotten better. And I mean, look, I'm wearing a short sleeve shirt today and I have no makeup on, but I feel confident that my skin looks decent. It's not perfect. I still have dry skin. I still get itchy once in a while, but everything I take with a grain of salt now. That's not the end of the world that I have a small little itch somewhere. Whereas that used to bother me, it's totally changed my perspective. And for people going through withdrawal, just like, look at me. I mean, yes, 2 years was hell, and I feel like I was robbed of 2 years of my life, but I have such a better perspective on things now. I'm healthier. My bathroom counter is clear, because growing up I had 15 different creams on my counter at any given time. And so I just feel like this incredible freedom.
Okay.
If I may just add on that this is a benign condition. We're not dealing with lymphoma. We're not dealing with multiple fractures after an auto accident, that these things take a year to 2. This is a benign condition. to begin with. And these patients are forced into losing much of their life while they're getting addicted. Cautious care, watchful worry, and then losing another couple years in the withdrawal phase. It's not fair. It's not fair for this benign condition to have taken that kind of life away from people.
So, Dr. Rapp, last thing for you, and again, thank you so much for your time today. Any last words for people that are on the fence, and then what are some resources that you can offer that they can look into to make that step towards reaching out to you or possibly another group, or you know, where they can turn to?
Well, I did start the new website 3 weeks ago because I had had it over my eyeballs with people from all over the world who were going through what Hanna went through. So it's red-skin-syndrome.com. And I put a new blog on every 3 to 4 days. It is filled with information, it's filled with pictures, it's filled with histories, and it can lead people to make a decision, decide what to do, and talk to their doctor, and find a doctor in their city who will go along with this, and or get in touch with me. And I would like to cure this problem. It's curable. Damn it.
Okay, so again, thanks again so much for joining us today in this interview. We hope that we've provided some insight towards something that probably has affected your life, and that's why you've come to this point in the video, because you wanted to hear every word. So thanks again, Dr. Rapaport.
Okay.
Hanna.
Thank you.
Beauty.